It is that time of year when people start thinking about the best ways to keep themselves and their family from getting sick. But health experts predict another wave of COVID-19 and new variants could be coming with the colder weather. Thanks for staying with us. I'm Amy Lutz.
And I'm Evan Forrester. We talked with an infectious disease physician from Wellspan about the biggest things you need to know about COVID-19 and testing this winter. As the temperatures drop, people may be wondering about another potential increase in COVID-19 cases and new variants.
As we know, there have been a lot of variants since January when the Omicron original variant emerged. We have seen multiple variants, including the currently predominant BA4, BA5, and there is another emerging variant called BQ1 as we get into the autumn and winter.
Dr. Tirupathi is an infectious disease expert with Wellspan Chambersburg. He says COVID case numbers are low in south central Pennsylvania right now. However, that could change in the winter months. He stresses that in-home testing can detect the latest variants of COVID, saying it is vital to cutting down transmission of the virus.
All the studies done so far show that the rapid diagnostic test, which is the home test that folks are using, perform reasonably well in terms of detecting the infection. There will be a lot of validity testing done by the FDA and other sister organizations to make sure these tests continue to perform well.
And if there's COVID tests in your home that are nearing their shelf life,
I would not recommend using those tests after that expiry date, and that's because those reagents may not be as effective as they should be. And subsequently, you could get a false negative or a false positive test.
Dr. Tirupathi says while most infectious disease experts are cautiously optimistic heading into the winter,
but are also worried about a dual pandemic of COVID and flu as we get into the winter. Surprisingly, the flu numbers are going up week after week.
His biggest suggestion for people right now,
the one big advice, and a very important one at that, would be to get up to date with your flu vaccination and COVID-19 vaccination.
And Dr. Tirupathi also stresses that masking continues to be an important measure for people who are immunocompromised or are taking medicine that weaken their immune system.